I have an opportunity to spend as much time with the patient as I like. Unlike an operating room, you do your job and leave. I enjoy talking with the people and finding out all the things that are behind people's lives.
Dr. Ralph Wilson makes sure his patients don't feel like a number. He has been able to do that by building long-lasting relationships since walking in the OrthoArizona-Mezona Division doors 45 years ago.
That was my first choice, and that's where I've been ever since. So when I came to Mezona and Mesa, I did everything. Unlike the current structure of orthopedics, I did back surgery, hand surgery, shoulder surgery. I did a number of tumors. I did all sorts of whatever orthopedics threw me at that time.
Now that there are so many subspecialty physicians in his practice, Wilson focuses more on doing shoulder surgery and joint replacements.
When I started in orthopedics, this was just the beginning of the joint replacement. I did the first joint replacement in Mesa in 1970 because I was the only person that had been trained at that point in town, and I helped other people in town learn how to do it.
Some other changes Wilson has seen since coming to Mezona is the number of staff working in the practice and the cost of office visits.
The cost of office visits has gone from $5 in 1970 to I don't even know what it is now, but it's a lot more than $5, I'm pretty sure.
The doctor went to the University of Iowa for his undergraduate degree and medical school. Wilson's decision to go into orthopedics full-time came after joining the United States Army and taking care of patients in Vietnam.
They drafted me after my internship, and I was supposed to go to be in the military. And I had a deferment because the hospital where I worked was short on residents. So I stayed 1 year and became a general surgery resident. Then I went into the service, and because of that training, and I requested to be an orthopedist area.
Wilson has also been very involved in medical missions. He has had the opportunity to go to more than 20 countries.
The best one was probably when I took my son to Zimbabwe for a month and introduced him to Zimbabwe medicine, which was pretty backward and a challenge, obviously, but a great experience for him.
So what is Wilson's secret to loving his job 45 years later?
I would tell them that they should do what they like. You know, if you don't enjoy what you're doing, and obviously I do, or I wouldn't have been doing it for 45 years, you have to enjoy it. And if you're not enjoying exactly what you're doing, then you better make a little change to make it more enjoyable.